Good morning, everyone. Thank you for being here, especially on this post-election day and World Cup and all of that. We're, on behalf of the registered nurses, I am delighted to invite you here as we look towards World Elder Abuse Awareness Day. Today we are releasing a set of recommendations from our upcoming best practice guidelines entitled Preventing and Addressing Abuse and Neglect of Older Adults, Person-Centered, Collaborative, System-Wide Approaches. My name is Susan McNeil. I'm a registered nurse, and I have been leading the team who has developed these recommendations we're speaking about today. Among us this morning are members of the media, some who are joining us remotely, experts on abuse and neglect of older adults, who I will introduce in a few moments, key stakeholders, and people who will be using this guideline in their daily practice. I'd like to start by providing you with a bit of background about the Registered Nurses Association of Ontario and our Best Practice Guidelines program. For those of you who are not familiar, RNAO is the professional association for registered nurses in this province, and our mission is to advance healthy public policy and to help registered nurses participate actively in improving the healthcare services that are delivered. We are particularly invested in promoting high-quality care. And one of the main ways that we do this is through our Best Practices Guidelines program. So this program has been funded for the last 15 years by the Ministry of Health and Long-Term Care. And during this process, we are very proud to say that we have developed 50 guidelines. Some of these are clinical practice guidelines, and some are guidelines that are focused on promoting healthy work environments. Our guidelines are all available on our website. Many have been translated, and they've been implemented throughout Ontario, across Canada, and in many countries around the world. And when we develop our guidelines, we do so in a very rigorous, very careful way. We have a research team who sifts through thousands of research articles and selects the most relevant, up-to-date, and high-quality research on the topic. Then we bring that research to a panel of experts, and the panel of experts reviews that and develops recommendations. After that process, once the guideline is drafted, we send it to stakeholders for a stakeholder review process. These are people who are experts in the field and who will be using the guideline, and we ask them to read it over and provide us with some feedback regarding are the recommendations relevant, does it make sense, is there anything missing, do you agree with them? So by the time we've completed all of these steps, we're confident that the recommendations will be useful in the field, and we start the process of helping organizations actually put the recommendations into practice and maintain those best practices. So now what I would like to do is introduce Dr. George Greenspun. She is RNAO's Chief Executive Officer, and she really is a true champion for our Best Practice Guidelines program and for promoting excellence in care of older adults. So she's not able to be with us here today, but she sent her greetings through video, and we'll watch that now.
Welcome, and thank you for being here today. I'm Doris Greenspun, Chief Executive Officer of the Registered Nurses Association of Ontario. We are proud to share with you preventing and addressing abuse and neglect of older adults. The association is grateful to Alice Wong, Minister of State for Seniors, and to the Government of Canada for having funded this very important clinical practice guideline. We are hopeful that this resource will be used across the country to ensure that our older adults do not suffer the devastation of abuse and neglect. The guideline, which provides over 20 recommendations, was developed by a team of experts, and they will share with you today each one of the recommendations. Alongside with the guidelines, we will launch webinars across the country, as well as an online education tool, so that we ensure that health professionals, families, and the public are well aware of how to prevent and address abuse and neglect of our older adults, whether they are family members, patients, or members of our community. Let's make sure that this resource is put to good use, because one is too many. One older person that is abused or neglected is too many. And we at RNO are endeavoring to put a stop to it. Thank you very much.
So this time I'd like to provide you with a little bit of context for these recommendations. The guideline we're releasing, the recommendations we're releasing are building on the work that we have done in the long-term care sector for the past 12 years, most specifically work with the Canadian Nurses Association on the PEACE project. And that was focused on promoting dignity and respect and preventing abuse and neglect of older adults. Now, this guideline is going to be applicable to healthcare institutions and settings, community settings across Canada. This guideline has been developed by a diverse panel of experts. We have experts from nursing, medicine, social work, law, policy, rural and remote communities, research and education. And we have 22 recommendations that cover 3 areas. They cover practice, they cover education, and we have recommendations for policy, organizations, and systems. So now I will introduce our 2 expert co-leads, and starting with Dr. Elizabeth Podmix. She is really one of the reasons why we are here today talking about abuse and neglect of older adults. Dr. Elizabeth Podmix is truly a pioneer in elder abuse work in faith communities especially, and raising awareness amongst children and adolescents. She has published in the area of elder abuse and has presented her research at national and international levels, and she is on the editorial board of the Journal of Elder Abuse and Neglect. She conducted the 1990 national survey in Canada on abuse of the elderly. She's organized and chaired the first and second national conferences on abuse in Canada. She's a founding member of the International Network for the Prevention of Elder Abuse, as well as the founder of both the Canadian and the Ontario Network for the Prevention of Elder Abuse, as well the World Elder Abuse Awareness Day that we are looking forward to on the 15th. Dr. Podmix has been awarded the Order of Canada in recognition of her excellent work in the field of elder abuse. So we would like to invite Dr. Podmix to now speak about some of the recommendations in this guideline.
Thank you, Susan, and thank you for inviting me here, and thank you to the members of the press who came out to join us here today in launching this really important document. A huge amount of work has gone into the background of it, and I certainly congratulate the RNAO in spearheading this document that will be used across Canada, not only for nurses, but for anybody who is interested and concerned about older people and about elder abuse. The 2 areas of the guidelines that I'm going to briefly mention are the practice guideline and the education section of the guideline. The practice guideline means the assessment, the planning, the intervention, and the evaluation of the practice, the work that is being done in both hospitals and institutions. And the important thing is that it is centered around the person, the patient, the client, but however you want to refer to the person who is the recipient of the care. And that person is the center of the care plan, and everything revolves around them. And nurses are in the position to carry out the practice that is going to result in both optimal care and the prevention of elder abuse. But equally important is the fact that in institutions or in hospitals, people have the right to decline care, to moderate it, to accept it. And if they do want to decline it, it is our responsibility to honor and respect that decision. We may think we know the best thing for them. Sometimes we do and sometimes we don't. But everybody has the right for self-determination and to say, at this time I don't want that, or whatever they are feeling in relation to what we plan and want to practice. It's essential that if somebody does refuse care, that we let them know that we're still there for them and that they can come back, and that we will come back to them and check it out. Have you changed your mind? Would you maybe like to report this situation? Can we help you? We still care about you. So people have the right to make choices, but they also have the right to expect that we're going to be there for them when they do need us. In terms of the education part of the guidelines, education, I feel, is the cornerstone of the whole area of prevention of elder abuse. And this education doesn't begin when somebody enters nursing school. Education is around people, older people, any people belong, begins at about age 3, which is when attitudes are formed. And if we can teach children at an early age to respect and care and love all people, then there will be much less elder abuse in this world. That leads into one of the concepts that we cover in the guidelines, which is ageism. Many people feel that ageism is the root of elder abuse. This all revolves around attitudes, like racism, like sexism, like all the other isms. And we can try to prevent that by starting early at age 2 or 3. Now, the education of nurses begins in nursing schools, and it's very important that we start developing that early. Young people go into nursing, or older people, or whatever age they go into nursing, because they care and because they want to make a difference. They want to be a change agent. And this is a time to inculcate attitudes that are going to see them through their professional career, and the result of this will be a minimization of elder abuse. In terms of education, I just want to lead into a minute and talk about the World Elder Abuse Awareness Day, which is coming up on Sunday. Elder Abuse Awareness Day is going to be on Sunday, but hopefully the work that we've been doing all year and for the past 9 years in terms of World Day, that those ideas won't just stop when World Day is over, but the actions and the changes that have come about will continue and become World Day every day. This year has been phenomenal in terms of the activities that have gone on, not only in Canada, not only in North America, but around the globe. And the interventions and creativity that have emerged from developing countries is really mind-boggling, and an illustration of how creative people can be in developing countries with so little resources to work with compared to what we have. We have government funding, we have organizations, we have volunteers, where, as in developing countries, they're working from scratch and they're doing an absolutely fantastic job. So we want to continue that. This year, as I say, has been really remarkable. Yesterday, President Obama came out with a proclamation. Assistant Secretary of Aging, Kathy Greenlee, reminds us that Father's Day is also about elder abuse. People think that men are exempt from elder abuse. 1/3 of reported cases in the United States are men. So we should be using Father's Day to also think about what we can do in terms of raising awareness about this really awful issue. In conclusion, I would like to acknowledge Dr. Greenspun and Dr. Bannock, who isn't here, for all the work, for obtaining the funding, first of all, for doing this. And that leads me into Minister Alice Wong. She has been a hero in terms of World Day and elder abuse prevention. She not only has supported it verbally, she's given funding, and that's where it really counts. So I know we're going to hear from her later on, but it's too bad she couldn't be here. She was here last year. But Canada is a leader in World Day, and I hope that we'll continue to do that. And next year is the 10th anniversary, and hopefully we'll have something really, really big then. But I also want to acknowledge Susan Story McNeil, who has led this project to where it is today, and her wonderful staff of researchers who have gone through so many articles. I mean, that's the background work that they've just given us the stuff to work with, so we really want to acknowledge them. And Verity White, who has been central to the project also. Now, Dr. Samir Sinha, who has been the leader really of this group, a really brilliant guy who has so much on his plate, and that's why the government has made him director of geriatrics for the University Network. He has been here for every meeting or every conference call, whether it's by train, plane, or whatever else, or wherever he has been, not only in North America but other places. He has been here for every meeting, and I think we wouldn't be here without his expertise. Also, I want to congratulate the nurses who are at the basis of all of this. Nurses are the most estimated people in professionalism. They score 91%, which is up 1% from last year in terms of ethics and honesty. And so nurses engender trust, and elder abuse is all about trust. Somebody who has been mistreated isn't just going to tell anybody what's happening, but they will tell a nurse, because the nurse is able to engender that trusting relationship that is so necessary for the intervention. So here's to all the nurses and all the student nurses, because they're the hope. If we can teach student nurses, then we're halfway there. Thank you.
Thank you so much, Elizabeth. It has been an enormous privilege to work with such an expert and someone who is so passionate on this issue. Next, I will introduce Samir Sinha, or Dr. Samir Sinha, and we already have a bit of an idea of how much commitment he has given to this project. A bit of his background is that he is a passionate and respected advocate for the needs of older adults. Dr. Sinha currently serves as the Director of Geriatrics at Mount Sinai and the University Health Network Hospitals in Toronto. In 2012, he was appointed by the Government of Ontario to serve as the expert lead of the Ontario Seniors Strategy. He is also an assistant professor at the University of Toronto and Johns Hopkins University School of Medicine. Dr. Sinha's breadth of international training and expertise in health policy and the delivery of services related to the care of the elderly have made him a highly regarded expert in the care of older adults. He has consulted and advised hospitals and health authorities in Britain, Canada, the United States, and China on the implementation and administration of unique, integrated, and innovative models of geriatric care that actually reduces disease burden, improves access and capacity, and ultimately promotes health.
very much, Susan, and this is a fantastic day. A good mentor of mine used to always say on days like this, today's a great day for being an old person, an older adult. Because I think this really represents a tremendous amount of work that has come together over the last year in particular. And as Elizabeth and Susan were saying, this has really been a team effort, right? Just as addressing this issue really requires a team effort. This really came through. We had funding from the Government of Canada. We had an organization that has an excellent track record of creating best practice guidelines that really valued this issue and wanted to make this a centerpiece of its work. And they were able to easily attract leaders in the field, especially Elizabeth, who has a long-standing track record and has been inspirational to me and many of my colleagues in medicine and nursing and social work, etc., around seeing the importance of this issue and wanting to take the time to make sure that we address this issue in a positive way. The prevalence of elder abuse is very common in our society. Unfortunately, as Doris Greenspun said, one person is too many, but we predict that between 4 and 10% of older adults are currently experiencing abuse or neglect in one form or the other. So unfortunately, it's a bit too common, but we talk about percentage points. Let me give you some numbers. We have 1.9 million older Ontarians currently, and we predict that upwards of 190,000 of them have been experiencing abuse or neglect in particular. This could be our mother, this could be our father, this could be our aunt and uncle, it could be a grandparent, for example, and one day it could be us. And as Dr. Greenspun said, one is too many because this is just not acceptable, and therefore we need to take change and we need to take action. Elizabeth talked about the importance of this being a fundamental area of practice, and I think this is why it's been so good that the RNAO has taken leadership on developing this, because when we look at some of the practitioners who spend the most time with patients, with older adults who may be encountering abuse or neglect, it will be that nurse who has a trusting relationship. But the goal was this wasn't just about nursing. Again, this is a collaborative effort. It's not just about nursing, it's about getting the doctors, the social workers, the family members, and most importantly, that older adult as part of the care team that's going to help us improve the situation and try and eliminate it whenever possible. So Elizabeth talked about the importance of this being a hallmark of the practice that we do fundamentally as practitioners, and how it's so important that we also focus on how not only how do we respond, but how do we educate our fellow colleagues so that they can respond appropriately. But I want to talk about two of the other major areas that we focused on as well. One was about recommendations around the system, the organizational and policy recommendations that we want to make. Because as we know, sometimes there are systemic issues, for example, and other factors that contribute to abuse and neglect at various levels in particular. And so presenting and addressing abuse and neglect really requires collaboration and concerted effort at all levels and working together, especially in the community settings. So we really focused on these recommendations on developing comprehensive prevention efforts in healthcare settings, such as long-term care settings, but also in the community. And so one of our recommendations really focused on in helping institutions adopt a combination of best practices to prevent abuse and neglect of older adults in particular. But we also know that to help implement best practices, effort is also needed beyond healthcare organizations. It also requires concerted efforts from governments and assistance from nursing regulatory bodies. I think much of the learning we did, and to understand the level of learning that Elizabeth shared with us, we went through 15,000 articles. That's how many articles and pieces of information the RNAO team helped us actually sift through so that we could come up with 22 best practice recommendations. We knew the really good ones were the ones that actually were built on a lot of Elizabeth's work as well, because I thought this is really well written. Oh, of course, it's Elizabeth's work. That's why. Very practical, to the point. So it kind of made our job a lot easier having a world expert at our side. But this is the key point, was we want to make sure that we could help implement best practices and really thinking about what governments and the assistance of nursing regulatory bodies could be. So we really focus around making sure that our professional associations, not just our nursing associations, but our medical associations and all of our different professional groups are really focusing on making sure this is a fundamental part of our education, to make sure people are aware of what are the signs and symptoms, and then practically how to actually address these issues when they occur. But we also recognize the need that governments need to put resources around this. Currently, we have a $50 billion budget for healthcare in Ontario. $1 million is spent in supporting elder abuse prevention activities in the province every year. $1 million. I argue that's a rounding error on a provincial budget, and I think we certainly could do more. Because certainly when I was talking to a group of nurses and social workers yesterday to give a lecture, they said, why aren't we putting more resources there so that when I encounter a case of elder abuse, I can do more? So I think there's an opportunity here where we've provided guidance on what governments, on what professional associations can do, and part of that recommendation is that provincial and territorial nursing bodies will provide accurate information on jurisdictional laws and obligations relevant to elder abuse in older adults and neglect across the continuum of care. And another recommendation was making sure that we could actually adequately fund prevention and education opportunities. Because what we heard a lot, and what I hear a lot in my practice, I certainly have encountered too many folks in my practice who are the victims of elder abuse and neglect. And what we often find is not just nurses, but physicians and other professionals find that sometimes they're not sure about what their responsibilities are with regards to the law, in terms of whether or not they should report abuse, what information is private, who should be involved in decision making, and whether and when there's an older adult that has decreased capacity to make decisions on their own, such as when they have advanced dementia. So I think there's an opportunity for us to provide more education and support and make sure that we have the appropriate amount of resources in place so that we can make sure that not even one person would be the victim of elder abuse and neglect. So I would again, as Elizabeth said, like to thank my colleagues, the panel that we had working on this, Elizabeth's leadership, Susan and the team here at the RNAO who provided us. It was like herding cats, frankly, and they did an expert job. So we appreciate everyone's support. And again, this was a team effort, and I'm glad that I was able to have the privilege of just being one member of that team. So thank you.
Thank you very much, Samir, and I'm so delighted that you were one of the colleagues of the team. The two of you together were next support for us and lead for the panel. So we are nearing the end of the conference. Before we proceed to some questions from the media, I would like to just once again thank Verity White so much for her support throughout this whole project. She's a project coordinator. All of the people at RNAO who helped bring this media event together, most specifically Marian Zitch and Melissa Di Constanza, our IT team, and our expert panel who volunteered hours of their time to bring this guideline together. So at this stage, perhaps I'll invite the media to ask questions if they like. Also, there's an opportunity to speak one-on-one with some of us afterwards.
Are you asking to ask the questions just here?
You're welcome to ask questions here, or you can talk to us one-on-one.
Maybe we'll do it one-on-one.
One-on-one? Okay, that's fine. So what I would like to do is thank you once again for coming today and giving your time this morning to show your support for this topic. And I would like to invite you for refreshments and to talk to us about the guidelines program and look at some of our resources. Oh, I am sorry, I forgot one important point. We'll leave with a conclusion from Honorable Alice Wong. She's the Minister of State for Seniors. And it is with the support from the Minister and from the funding of the federal government, the Government of Canada's New Horizons for Seniors program, that we're able to actually give you this guideline. So I'll let her have the last word, and we'll listen to her now.
Dr. Sinha, Dr. Podmix, friends and colleagues, thank you for inviting me today. I'm sorry I cannot be here in person, but I want to briefly bring greetings and commend you on the important work you're doing. And indeed, you're all here to highlight a very important day, a day that shines a light on elder abuse. World Elder Abuse Awareness Day confronts the many forms of elder abuse that affect seniors from all walks of life across this great nation. This day helps to break the silence and shows people the reality of this problem. Our government takes elder abuse very seriously and is tackling this problem in many ways. Through the Protecting Seniors Act, the Victims' Bill of Rights, the New Horizons for Seniors Program Pan-Canadian Project, and many other measures, we are standing up for seniors and saying, enough is enough. But we cannot do this work alone. Everyone has a role to play in this fight. That is why I'm so thankful for organizations like yours, the Registered Nurses Association of Ontario. You're taking real action. Through your research, you're building best practice guidelines on elder abuse prevention, identification, and intervention. These are the tools Canadians need to help put a stop to elder abuse. I thank you for your good work and look forward to seeing the guidelines myself. The need for awareness is vitally important. Often, people don't know what their rights are or what elder abuse can look like. I've also been working hard to build awareness with seniors across Canada. My website, www.seniors.gc.ca, is an example of these efforts, and I encourage you all to visit the section on elder abuse when you have a chance. Thank you again for inviting me today. I wish you all the best for the rest of your event. Thank you.
Okay, let's ask you the closing remarks. Once again, thank you very much for joining us today.